Morning. My name is Catherine Hanna. I am a fourth-year medical student at the University of South Florida, and I'm in the International Medicine Scholarly Concentration Program.
Hi, I'm Elimarys Perez-Colon. I'm one of the assistant professors for internal medicine and pediatrics through USF. And I'm also the associate program director for our Meds-Peds residency and a mentor for the International Scholarly Concentration.
You do a lot.
I try to be involved in a lot of things.
Yes. So we're here to have a conversation about global health. Can you tell me a little bit about yourself and how you got into the field of global health?
Yeah, absolutely. So I grew up in Puerto Rico. And the interesting thing about it is that even though Puerto Rico is part of the U.S., and we've been citizens since 1917, there is a big disparity when it comes to healthcare, comparing Puerto Rico with continental U.S. And there is a big amount of people that are living there under the poverty line. The estimated about 2017 was about half of the people. So it's a very substantial gap that we see there. And though I didn't personally, I was fortunate enough to not experience it personally, I did see it through friends and peers and family members, what that did to their overall health. And as such, I wanted to be involved in different programs, and I did do some things in Puerto Rico pretty early on. But when I was 15, I got invited to a medical mission trip, is what they call it at the time. And I was very interested in it, even though I didn't know I was going to be a physician at the time. And I did go and help with translation, as well as some, basic vital signs and things like that. And even though it was a great opportunity, and later on through my college experience and medical school experience, I did go to a bunch of different trips around Latin America. What I did see, though, is that there was a lack of sustainability. And though the trips were really great for the people that went to them and participated in them, it wasn't as meaningful and successful in regards to the long-term impact in the community or for the community. And that really drew my attention more and more, and I decided to have a substantial part of my career focus on providing high quality care that is community specific and can be sustainable.
That's awesome. Yeah, I've witnessed you with a bunch of projects that are acting towards sustainability and high quality care. I know that is very important to you, and I've seen it in your work also. So overall, why do you feel that global health is an important field for us to address?
I think global health is important because we all join healthcare because we like to serve. And really, we can lose focus from the fact that service doesn't end in just dealing with the patient that you have in front of you. Is more of the overall health of the community. And we are all a big community, and oftentimes we think about our community, just our surroundings, but it goes beyond that. And I really strongly believe that every single person should have access to healthcare, because it makes a difference in the long run. It makes a difference in their quality of life. It makes a difference in how control chronic disorders are. It makes a difference on how early diseases that can be cured and can be treated appropriately can be detected. So it is not a privilege. It shouldn't be a privilege, I should say. But unfortunately, we are treating it as such. It should be more of a right to have that access to healthcare. And there are so many communities around the world that do not have that access, that do not have the resources to be healthy, to wellness, to education, to so many other things that are things that we think about it. We think that they're small, but they do make a big impact. So I think it's important that young future physicians such as yourself get involved in healthcare to try to close that disparity gap that we are seeing between developing countries as well as even within our country.
There's a lot of work left to be done for sure. What kinds of global health efforts have you been engaged in prior to COVID-19?
Well, I've been in multiple projects with you guys, with the students who our ESF students are just amazing. So a couple of the projects that I would like to highlight, they kind of fall in different categories. One of the categories is education, because we think about global health and we think about the traditional, we set up a clinic, we see patients, we offer care to them, but there is a whole lot more to it. So one of the things that I've been working on since 2013, 2014 or so is an educational project through University of Panama, in which I go and work on educating their providers and medical students in high quality care. We do cost effective care. We talked a little bit about case based learning. We talked a lot about community specific algorithms to care for the community according to what the resources they have available. And I think this is important because we do have a lot of really great guidelines within the US and even, and of course, in Europe and other areas that we use. But when you are in a resource poor setting, you know the guidelines, but you might not be able to apply that. And most importantly, we have to consider the culture. If we can communicate appropriately with the patients and their beliefs and what they believe to be true, then we're not going to be effective in providing care for them. So this is one of the things that I've been involved, and I think is important because we have to be really cognition of the cultural differences when we're caring for patients. And education is very important. The other project that is near and dear to my heart, unfortunately, ended, but we learned a lot about it, and we have the structure to. I know you, Kat, have been involved with that project, and you saw how much we all suffer once it had to temporarily end. But we learned a lot from the structure of the project. So this was a clinic that was set up in a suburban area in Nicaragua, kind of right in the outskirts of Managua. And this clinic was serving a beautiful community that was pretty close. And through this project, we were able to create sustainability in the means of having a local physician and nurse attend the clinic, and then on 3 times a week basis, so the patients will have continuity of care. They will have access to emergency or urgent health care. And then twice a year, we would go to enhance that capacity through having more doctors, so more volume, as well as offering specialty care through internal medicine, pediatrics, and OBGYN. So this project was really neat because we got to be really close to the community, and we served them for about 5.5 years. And then it was very sustainable. Because of the political instability in the country, it was deemed unsafe to continue to serve the community. But we're really hopeful that soon we will be able to go back and continue with the project. But what we did is we learned from it. We learned community specific care. We learned how to cohort patients to offer care for chronic diseases such as hypertension and diabetes. And we're putting that to practice in other areas. So we have been looking to work with other countries, particularly in Colombia, in affiliation with the University of Cartagena, to try to build up a similar infrastructure in which we help and assist and guide them, but it is a local efforts and it's led by a local physician and or hopefully multiple physicians if we could expand it. But that's one of the projects that we are currently working on, and I know that you're a part of it. So it's kind of on hold because of this whole situation, but we're continuing to work with a needs assessment, and hopefully we'll move forward. The last thing is it falls a little bit more into the short-term project, which will be disaster relief. Um, I I didn't know I was interested in disaster relief until I was kind of put in that position. So in 2017, unfortunately, Hurricane Irma and Maria decimated Puerto Rico completely. And we wanted to do something about it. And of course, being from Puerto Rico, I always wanted to get back to my community. And by working on this project, I was able to do so. And of course, it wasn't a solitary effort. There was a lot of people involved, but we're able to start clinics there and support the healthcare system in a short-term setting when they needed us the most because of the volume of patients as well as the acuity of the different disorders after a natural disaster. Because it was such a great experience. We created a protocol for hurricane relief from the healthcare standpoint for USF, alongside with Dr. Oxner. And we together created this protocol that we use to assist for Hurricane Matthew in the Panhandle. Then we use it for Hurricane Dorian in the Bahamas. And hopefully we'll continue to use it. And today, well, we saw Hurricane Laura in Louisiana. So I'm not sure that I'll be directly involved with this one, but it's good to have protocols in place to help and assist people when they need it the most. So those are just a summary of the most meaningful projects that I've been involved with.
And that's just a summary, which is awesome because I think that each category is so important and so difficult to handle on its own. It's kind of amazing that you're involved in so much. While you guys are watching with Hurricane Laura, has there been talk about using the protocol over there? I know it's further away than Matthew was.
Yeah, absolutely. I think, it's slightly different now, right? So we are in the midst of a pandemic, and then on top of that, we're dealing with this. So we'll have to revise a lot of things, but and then see if it will be safe from the university standpoint to provide relief. I think because of the unique situation in which we are at right now, the best bet will be to provide them with the supplies instead of the human efforts, the physicians and nurses and so on, that they might need to care for their own community. But it's something that we're looking into already.